He was thinking about making me something for Christmas.
You should make me something for Christmas. No, I'm just kidding.
I tried making a freaking canvas. It was a Harry Potter canvas at Gabe's. I was like, I should buy that for you.
Everyone's gonna give me Harry Potter stuff.
Also, Five Below has a whole section of Harry Potter ornaments. Just saying.
I did a Harry Potter tree last year. And I need to go. Okay. Chapter 19, massage for special populations. Mamas to be. That's one of them. So prenatal massage. Woo-hoo! It's also called pregnancy massage. Prenatal means they are pregnant. So this is massage during pregnancy, and it's generally safe unless they are considered high risk. So for prenatal massage, we do have to take into account positioning is different. We cannot just flip them over, stick them on their belly. They also might be uncomfortable. So usually, and everybody does things a little different. Usually for the first couple months, you can still, they say, still put them prone on their belly. I don't. Unless, like, it's the first, I will work on someone first trimester. You don't have to. Most people wait till second. Yeah.
Is it Allie or Alyssa?
Whatever you want to call her. It's both.
Okay.
Allie's her nickname.
Okay.
I still call her Alyssa, still proper. But I used to wait till second trimester, but if they're close towards the end, I don't care as long as there's not complications. But you can do what you want in what you're comfortable with. Now, here it says in the book that you can put them prone for the first 2 months, 3 months. I will only put them prone if literally they are like 5 weeks pregnant. I don't know. If they're very, very, very early and they're not showing anything, okay? Because the baby is so small then that you're not squishing it if you're laying on your stomach. But I just don't usually, okay? So give or take, feel what you're comfortable doing there. For supine, once they hit, and usually I've been doing this anyhow, once they're in their second trimester, which this says after 22 weeks, make sure they're semi-reclined. This avoids weight on the fetus from pressing on the vena cava. So if the vena cava is pressed too long, it'll restrict blood flow and it can drop the maternal blood pressure. So this is why we don't work on pregnant women flat. So always give them something to kind of bump them up a little bit. Does that make sense?
Walmart has a wedge
Get it.
in the pillow section,
Get it.
and it was like $20, $25.
Oh, I should have brought my wedge. Because all we have is pillows here. I'll have to try to remember. I bought myself a wedge for last week.
Oh, okay.
So I can sit in bed.
Like
It
the
was
one from Walmart?
No, from Amazon. And then you just, what I do, because it's a fabric one, I throw a sheet over it so that they're not touching it. Because then you got to unzip the cover and wash it per person. So, for pregnancy massage, we'll prop them up with whatever you got. I recommend getting a wedge and pillows. Most importantly, and the most comfortable for mama to be is side lying position, which we're going to learn how to do. Side lying position is the devil. I hate it. Everyone hates it. It's very uncomfortable to try to do the posterior part of somebody's body. And side lying, I usually just sit for it, so I'm low to the table. If you have a hydraulic table, you can stand and bump it up. So just keep in mind that it's not fun, and you guys all get to practice it today. Hee hee hee. So a lot of times, women who are pregnant, a lot of their areas of discomfort, everything. I should just put everything. Their neck, their upper and lower back, hips, legs, feet, all right? Their body is changing. Their hips are starting to, all the ligaments are starting to get loose, all right? So that it can have a baby, right? So you're starting to have looser hips. The muscles maybe are having some strain because there's weight in the front, and now we're having a tilted pelvic anteriorly, right? So just keep that in mind. things start changing and hurting. You can still do a decent amount of pressure on a pregnant woman, except on their legs. All right? No deep pressure on their legs. You want to avoid blood clots. Because if they have a blood clot and you push deep, you might kill them. So hope you have liability insurance. So if you have somebody who comes in and they typically get deep tissue massage, tell them, I cannot do deep on your legs because you are pregnant. I can do a little firmer touch on your shoulders. I would not do a full deep tissue. I would just bring it to a firm pressure anyhow. You can do abdominal. I usually don't work on a woman's pregnant belly, but if they're having a lot of discomfort, you can kind of do some stretches, some myofascial stuff just to help give them a little pressure. You can learn how to kinesiotape and K-tape their belly so that there's less pressure. I almost did that. I was looking through my closet last week because I was like, it hurts so bad. I just feel like I need a lift. Yeah, so that might actually help them. If you want to work on more pregnant women and you want to specialize in that, I would learn K-taping for pregnancy. And I'm going to show you guys a little demo next semester on K-taping because why not?
So can you take just a special class just for general K-taping?
Yeah, you can do one online
Okay, okay.
and be done. Yeah.
That's what I want to do.
Contraindications for prenatal massage. Morning sickness. Schedule during times where their nausea is less severe.
Good luck with that.
Right? You might want to have a puke bucket on hand. Oh, guys, I got to pause this.
Oh my god. This carries my point.
Hold up. I got to tell you this. Sorry. All right, let's talk about morning sickness. All right, so schedule the nausea or the massages when they're less nauseous if you can, or accommodate. No bags with holes in them. So nausea, if they have diarrhea, they're probably not going to want a massage anyhow. Nobody with diarrhea wants a massage. I don't want to massage anyone with diarrhea. So if they're having vaginal discharge or vaginal bleeding, all right, that might be high risk. I mean, some women bleed during their pregnancy, you know. But if it's concerning, I would have them see their doctor. If there's decreased fetal movement, if they're noticing something ain't right, mamas know, do not work on them, please, right? Either they could have had a miscarriage and the baby's, you know, deceased, or maybe things are going south and something bad is going on. So you don't want to be blamed for a miscarriage if something is already happening. Pitting edema. So that is when you have swelling and you can push and the dent stays. If they have pitting edema, because a lot of pregnant women start getting swelling in their legs, their ankles, do not work on their pitting edema ankles because that's terrifying, okay? Just avoid. I might even avoid the whole massage. You know, that's my personal advice. Preeclampsia. Varicose veins with anybody, or deep vein thrombosis with anybody. So this is why during the intake form, you could have a special intake form for pregnancy massage if you are comfortable doing prenatal massages, where it asks specifically which term they are, how many weeks, whatever, if they've had any high risks and whatnot that they would have to sign a waiver for. So you can do that if you'd like. A lot of times also people will get on your table and they don't know they're pregnant and you just do your normal massage. That's fine, right? Because nobody knows. But if they already know they're pregnant, by the way, I'm pregnant, it's really frustrating because, you know, the intake form, they usually don't book the correct massage and whatnot. So that is why if you do prenatal massage, make sure you have a separate service that says pregnancy or prenatal massage so that they know what they're booking, and then you can change it too and kind of watch the progress. I always put, for subjective, I ask them every time, how many weeks pregnant are you? And that's always in subjective because they're telling me they are 23 weeks or 37 weeks pregnant, and then I can keep track of it as we progress through their pregnancy. That's my advice there. All right. Maternal concerns. A lot of these maternal concerns happen in the first trimester. And that's why massage therapists get nervous because, again, we don't want to be blamed for a miscarriage. I think massage is generally very safe unless there's a high risk issue going on. And also, if it's a first-time mother, they might not know if they're high risk either. So if you're more comfortable, wait till trimester 2, okay? So risk factors in the first trimester would be anybody under the age of 20, according to book, and anyone over 35 is considered a geriatric pregnancy. Isn't that terrible? Awful. I mean, people didn't live that long until medicine got better, so I think normal people lived maybe 50-something. That was, like, old. Now we're living longer. Any previous complications that you've had with this pregnancy or past pregnancies, previous abortions or miscarriages, you want to know this stuff and take into account whether you're comfortable working on someone who's had multiple miscarriages, okay? Multiple gestations. If there's twins, right, things are a little more complicated. You could still work on somebody who has twins, all right? Just watch for more strange signs, edema, pain, swelling, anything that seems a little off. Maternal illness. So any illness, regardless of whether you're pregnant or not, you should not work on someone who's sick. Any genetic problems they might be having that would affect the baby. Exposure to drugs or other hazardous materials. If you're pregnant and you are exposed to drugs, you suck. That's my personal opinion. All right, here's some concerns with the last 2 trimesters. So if you haven't already guessed, tri means 3. There's 3 trimesters, right? For people who haven't had babies and know nothing about it. Second, I've never had a baby, so there's that. Second trimester would be week 14 through week 26. This is smack dead in the middle. This is when your body starts producing relaxin. It's a hormone. This is what causes you to have relaxed connective tissues in your hips and everywhere else. So be mindful of range of motion techniques on pregnant women. You don't want to like pull them out of socket or something or cause, a tear or an injury.
And they don't always necessarily feel or know that
Yeah.
they're beyond their normal range of motion, because we have to be cautious of that in yoga.
Yeah.
Like, oh, I can get really deep in this
You're like, but
pose,
don't.
but yeah, don't.
Wait till the baby's coming out, then get deep in that pose.
Actually, it takes several, I think it's either 2 or 3 months for the body to go back to a normal level of relaxin after.
Yeah. Because you need that high level to have your hips open up and have a natural birth.
Your hands
Yes.
get so much bigger.
Scary. I think pregnancy is insane. Like, what a woman goes through her change in her body, like, we are badasses. Women are badasses. Men can be badasses too, I guess. I guess I shouldn't say that. I shouldn't say badass on the internet in a lecture. It's fine.
You said it 14 times.
14? All right, remember, second trimester, semi-reclined position when they are supine. So typically you're looking for about a 48 degree to 70 degree angle, not 90. Nobody wants to sit 90 degrees.
48 or 45?
45, sorry, I'm making up numbers. 45, if you think right angles like this, 45 is like that, right? So anywhere in this little position. Whatever's comfortable. Sometimes you have to keep changing your positions because they're not comfortable. And that's okay. I've done like 10 minutes of them supine, and then we turn on the side for 10 minutes. I've done that where we're constantly switching back and forth the entire massage. That's usually in the third trimester, though. Trimester 3, 27 to 40 plus weeks. During your third trimester, this is when there's increased pressure on the organs. The baby is getting large and in charge. Increased pressure on blood vessels, lymph vessels, abdominal muscles. Everything's just got a lot of pressure. An extended supine position should be limited or avoided. You might do more side lying towards the end. Right, you had mama, now we have babies. Babies can get massages too. It's fun. I actually did I've only done it once, but I did an infant massage class, and like 4 mamas, I think it was 4, brought their new babies in, and we did baby massage. We did at one point have to stop the class so that everybody's diaper can get changed and they can get fed. I did not add that timing into my class. At one point, all babies were crying. And I was like, I am so glad that I don't have a child. Although when all the dogs are barking at once, I'd rather have a child. So why would you massage an infant? It's a good bonding experience. A lot of times what we're doing is teaching the parents to massage infants. They're not just bringing their babies to us to do baby massage. It would be. Unless there's something wrong with the baby, like torticollis. All right. So typically, if you want to offer something like this, it could be like parent and baby massage where you go and show mom or dad or whoever has the baby on how to do these massages. So it helps with bonding between the parents. It helps with communication. It can relieve tension and pain. Babies can have tension and pain too. They're sleeping in some weird positions. It stimulates, the body as a whole, and it also can relax depending on the techniques you're using. The contraindications for infants and children are the same as adults. They are humans, although you're not doing deep tissue massage on a baby. A lot of it is very gentle strokes, a lot of range of motion, a lot of effleurage. You can throw in your abdominal massage with babies. It's really good for digestion. But with the babies, I wouldn't be digging. It's more just hands flat, rubbing the belly in a clockwise position. So babies are fun. And then there's the bicycle bob move. Do you know what I'm talking about? Here's the hip. Here's the hip. Here's the baby. I'm grabbing the legs. And we go bicycle, 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 bob. And then their feet go up. And
I don't think that I've ever heard the little bob.
yeah, it's a nice deep stretch. Does anybody want to bring a baby in?
I can't in like another 2 weeks.
We need to make a plan. We need to make a plan to bring a baby in that can get a massage.
I'll ask my daughter-in-law once baby gets here.
Heck yeah.
It's gonna be today.
Oh my God, I need this baby. I think babies are weird, but I need the baby for teaching. When you're working on an infant or a child, typically your lubricants will be food-grade oils. This would include, but not limit, sweet almond oil. Grapeseed oil is a really good one. Olive oil. I wouldn't actually put olive oil on somebody, but whatever. I say avocado oil, anything like that. If baby has allergies, do not do sweet almond oil if they have a nut allergy. Jojoba oil. So, limit fragrances or scents. A lot of baby products have lavender in it. Just skip the lavender. You don't know if this baby has a sensitivity, and you don't want to give baby a rash of some sort, contact dermatitis. Typically, when you're doing, there's actually a whole technique in the book. A well baby active massage routine lasts about 20 minutes. Baby might not be able to handle that. It might be a 5-minute massage. So just pick up on their nonverbal cues, because if they are crying or pulling away or just seem crabby, they don't want you to touch them. So it could last 20 minutes. Simplified routine lasts about 15 minutes. It's very light techniques, gentle stretching. End it if they seem fussy or discomfort or show signs of discomfort. I have an idea. Somebody can pretend to be a baby today. We can do massage on them. Who wants the bicycle bob? No, I'm just kidding. I'm not really doing that.
Breakfast bars, I'm gonna eat, that could be dangerous.
Bicycle bob. Woo! Children massage or youth massage. I call this youth massage if they're under 18. You can have different categories. If you like working, I like working on the kids. I think they're really fun. My office is a family-friendly place as long as that kid has an appointment. If they don't, please keep them at home. People, I will tell you, people will bring their kids with their appointment. If you don't want that, make sure you state it in your policy that kids cannot be at their appointment unless they have an active appointment with you. If you want to kind of drop down the noise volume and not be distracted.
I want mom to be distracted or dad to be distracted.
I don't even know where this thing is.
I like mine because they're cool, but like I don't like it other people's kids. Our house is a kid-free house, which is absolutely hilarious because other people keep trying to.
Yeah, I'm trying to figure this out, but I don't know.
No, they're like.
I'll tell you a story after this. Massage for children. If you are working on children under 18, you need to have a signed consent form from a parent legally. Or a guardian if they're not under the care of their parents. Or they cannot receive body work. We do the same thing here at the clinic. If we don't really have kids, but we will. One of you will be working on a teenager for your practice clinicals. She's a sweetheart. She has really pretty hair too. You guys, she's so cute. She's so freaking cute. And mom will be signing a consent form here. So it's a client of ours. The parent can remain in the treatment room during the session if you want them to. It depends on what the parent wants. First session, 1,000% have them in the room with you. You might have a policy where they always have to be in the room. Do what you want. My kids, I used to have a parent or a sibling, somebody always in the room, and then as they have continued to see me more often, they trust me now, and parent sits out in the lobby because they're like, I'm a big kid now, and I don't want mommy or daddy, and we're chill. They know what to do. They know how to get on the table. All is good. But if you still feel uncomfortable being alone with a child because, people are cray out there in the world, you can always have the parent with you. You may need to massage over clothing. Kids aren't necessarily going to be, just in their underwear under the blanket, comfortable with that. The parent might not be comfortable with you doing that. So a lot of times I'll tell them for like little girls, you can have them wear a t-shirt and like shorts. A little boy, same thing, t-shirt or a sleeveless tank top of some sort. Sometimes they'll give them like a little bra, like a little sports bra. And just know that you're not taking it off. You're letting them keep everything on, make them comfortable, make the parents comfortable, make you comfortable, and that we are just working through clothing if we have to. Look for signs of abuse. This is a big one. It is our responsibility if we notice that a child that we are working on or anybody is showing signs of physical abuse that we need to call the cops, report that. You might lose a client after that, but at least the child might be in a safer place then. So again, same contraindications for adults, go for children. Again, we're all human. You're also not going to be doing deep tissue massage on a child either. Teenagers, maybe you can get to that point, the athletes. We get a lot of athletes, gymnastics and whatnot. It'll actually really help their game. Plus, if you work on one student athlete, they might tell their team, and then next thing you know, you got a bunch of cuties, like little like volleyball or little football players, like getting massages. It's cute. Determine if the client is active or frail if they're... I love that it's clients over 55. I don't think people who are 55 are frail, but to each their own.
Depends upon the client.
Yeah, you can have a frail 20-year-old if they're just not healthy. Determine if a client is active or frail if you're working with... We're going to not say 55 seniors. We're going to say seniors. Okay, frail clients might need help getting on or off the table, turning over. They might have issues laying down. So this is when you could also prop somebody up with pillows, a wedge, like a pregnancy massage, stick them on their side. If they can't lay, you might have to bust out a chair and do a little chair massage just to give them some relief. So effects of aging. As we age, we actually lose muscle mass and become weaker because we're not using it. So there are some seniors that are like really doing it. They're like still running. I had some guy that had his first heart attack at like 85 and he had ran his whole life. I was like, oh my gosh, you're in great shape. Some people at that age might not be getting out of a chair. So determine how active or frail they are. If they have muscle weakness, work on those muscles to bring some blood flow and nutrients to it. They might have a stooped posture, so you might have to accommodate for them not being able to lay flat, like I've said. They might have reduced ability to perform normal tasks that we can perform without any thoughts. It could be something as stupid as going to check the mail or picking up a gallon of milk, using the bathroom. It might be hard for them to get on or off a toilet comfortably, get dressed, stuff like that. With muscle mass loss, there's also loss of bone mass. The cartilage is either thinning and wearing away or lack thereof, and we're on bone. A lot of clients tend to have high blood pressure. They have a higher risk of lung infections. So you might have an old client that it's cold and they cancel their appointment because it's cold. And if you don't like that, then you can charge them and be a meanie or try not to, I don't know, try to work around them in their disabilities perhaps. They might have declined neurological function. They might have a reduced ability to hear and see. This happens a lot, and you feel like you're screaming to them because they can't hear. They forgot their hearing aids at home or in the car. You might have to help them fill out fill out intake forms because they can't read the tiny print. If it's all digital, there's no way they did it themselves online. So sometimes I will literally have my tablet in front of me, and I will ask them each question as I go down the line and fill it out for them. So if you have a client that is elderly or frail, you might have to schedule extra time for them. Okay, an extra 15 minutes because you know that, they're a little slower so that you're not rushing them out the door. And then if you really want, you can be awesome and walk them to their car. I don't do that, depending. But you can if you want.
I want to put on like the pickup and delivery service. Like I'll pick you up, bring you in, take you home.
For an extra $10.
Yeah.
Just give me some gas money. Benefits of senior massage. These old people are so happy right now. Look at this. So again, this is all like general benefits of massage, but this is specifically for the senior population. Improved flexibility and mobility. It reduces cramping and spasms because maybe they're not moving around as much. It reduces anxiety. As you get older, your anxiety gets worse. It can help reduce pain because things hurt. Your bones and everything have been on this earth for trillions of years. No, not really. For what seems like eternity. Everyone's like, my advice to you is don't get old. All the old people say that. It's cute. It reduces blood pressure temporarily. It promotes digestion and elimination. A lot of older clients aren't getting the diet they need. Things aren't functioning as well. They might be constipated is a big one for older people's constipation. So you might want to suggest abdominal massage for old Meemaw or Peepaw. It provides a nurturing touch. A lot of people this age, they might have lost a lot of friends and loved ones and spouses, children. This provides a touch that, maybe they're not getting anymore. It improves abilities to perform activities for daily life. So you're helping them so they can start to feel a little more independent again, right? All right, moving on. Clients with disabilities. there's a difference between a disability and an impairment. So, a disability is a physical or mental impairment, usually due to an injury, an illness, or a condition present at birth. An impairment is a physical functional abnormality or disorder that restricts the ability to perform normal daily activities. Think of it like this. Your vision is impaired. You need glasses, right? So that's an impairment. Blind is a disability. Or maybe a paraplegic disability, something like that. When working with people with disabilities or impairments, it's important to ask if they need assistance. We are human. We need to be a little nicer to each other. So again, with people with disabilities, you might need to take into account that they may need more time. Like if I work on someone with cerebral palsy, a lot of times their parent or guardian are bringing them in, carrying them because they're wheelchair bound. And I have steps, which is not the greatest. But it is ideal if you want to work with disabilities to make sure you have a handicap accessible entrance. Right, so if somebody has a auditory impairment, sound, can't hear as well, you might want to communicate via paper and pen or a tablet, write things down, and they can answer you back. You might want to point to the client's area to put their clothing. So be verbal if they can hear a little bit, but you want to show nonverbal cues too. Like clothes are going to go on this chair. So kind of like that, right? If you know sign language, that's even better. I don't. Gesture how you want them to get under the sheet. So you would really slow it down and show them, take off your clothes, put it there, get under. I would pull the sheet down, get under the sheet, cover up, okay? I've never worked on someone who's totally deaf, but you want to read their nonverbal cues, whether they're twitching, moaning, holding breath, making noises. It's either good or bad, okay? If you want to get their attention, you can tap their shoulder, put your hand on their back if they're face down. Gently, don't just... Just kidding. Oh, I love making fun of you. So you can tap them and let them know when it's time to turn over or that the massage is done. Visual impairments. I don't know if I've worked on anyone who's blind. We do have a client who's visually impaired, but he can still see some. And I've had people that have some blindness, but not total. But regardless, make room if they have a service animal. Don't pet the service animal. This dog is working. Unless they say you can pet my dog, don't even ask. All right, this dog is at work. This is their job. You might want to help guide the client safely to the room or around furniture. Make sure you always have a clear, open spot. This is why it's bad to have teeny tiny rooms, because you can't move around easy. You can help them fill out their intake forms. So unless you have someone reading it to them, they probably have no clue what it says. So help with that. Verbally let the client know when you leave the room, when you enter the room. They can't see you, so you can, they can hear you. Maintain contact during the treatment. Because they can't see, you should do that anyhow as much as you can with anybody, so that they always know kind of in what area of the body you are at. Also, some people might be asleep and you startle them if you just abruptly touch them. Then they scream, you scream, we all scream. Limited mobility. So create a clear path to and inside your treatment room. You might need assistance. They might need to have assistance getting on or off the table. If they do this, you can do the draping where you wrap the blanket over them, right? And then lay them on the table, and then they can, be naked under there. Table height should be low enough for them to get on safely. For all you tall people in here, if you don't have a table that goes up and down with a hydraulic system, make sure you have stools that are very sturdy that your clients who are shorter can comfortably get on and off the table.
I had to take a step stool in last week.
Short.
She also needs a knee replacement, so.
Yeah, so mobility issues. Paralysis or amputees. Caution when working on paralyzed areas. You don't want to go deep. They can't feel it. So you're just trying to promote circulation at that point. Ask the client if they can remove their prosthetic limb for the massage. If they don't want to, that's fine. Work on the contralateral limb if there's phantom pain. This is a cool thing. It's called the reflex relief. A lot of times if you're missing a body part, if you work on the opposite side of that body part that's still intact, it can help with phantom pain in the area that's gone. So if you guys don't know what phantom pain is, say for instance, I lost my hand, right, and I have a nub, and you're getting nub massages at that point. I'm not giving up. But I can still feel like I have hand pain, even though it's not there because of the nerves. So what I would do for a client like that is work on their left hand to help relieve some of the neurological confusion and relieve that stress. I've actually had somebody who had a prosthetic leg before, had no clue when they walked in until I saw it sitting by their stuff. So I'm like, oh, I don't think that's even on my intake form. It's real weird. It's real weird.
Gotta uncover and be like.
Then steal their leg and hide it somewhere in the office. No, don't do that. That's rude. If you have good rapport with that client, you can totally mess with them. Massage them with their foot. Yeah. Anywho. Man, unhinged. Massage for the critically ill. This is your oncology massage or just somebody who's terminal. So there's a lot of studies on this. What it's come down to is that speeding up blood flow and lymph flow is very unlikely to spread cancer. All right? But most practitioners who perform oncology or cancer massage need advanced training. If you're working on someone with cancer, use slow, gentle strokes or energy work. You can notice their physical or emotional condition is constantly changing. They're depressed, right? They might not be ready to leave this earth. They might not be comfortable with whatever their faith is yet. They might be angry at their faith, whatever, right? Just know that that state can constantly change. And also, they might be undergoing treatment that is taxing on their body, so they're not having a good time. Pain medication may alter their perception to pain, so we're not going super deep. They might not feel as much as a normal person who's not medicated would feel. I would say overall, though, the pros outweigh the cons for oncology massage. Benefits. It provides some pain relief. It's not going to get rid of everything, right? It reduces nausea. It can help digestion and elimination. Relieves stress. It relieves anxiety. Relieves depression just a bit, right? It promotes relaxation. It can help with insomnia. Improves flexibility and range of motion. It increases body awareness. Restores their positive body image sometimes, right? It can enhance self-esteem. Improves their outlook on life or quality of life, and it can promote, it says Heath bars, because they like that. No. It promotes health, generally. So the progression for cancer, you have your onset, something strange is going on. Maybe they don't even know something strange is going on unless they're going in for another reason. So this is where they would have their diagnosis pre-treatment. Then there's the treatments, which could involve a lot of things depending on what kind of cancer might be going on, how advanced it is, right? This would include surgery, maybe to remove the cancer or the lymph nodes or whatever's going on, radiation, chemo, hormone therapy, immunotherapy, stem cell transplant, experimental treatments, alternative and complementary medicine. Some people don't want to do anything, they just want to be natural, right? It is also not your job to tell them what they should do based on your beliefs. Then they might have remission, and it says survivalship, right? But not always. So sometimes treatment doesn't work. The disease metastasizes, it advances, and then there's end of life. Regardless, there's one thing all of us have in common is we don't escape death. Very morbid class. This is Halloween week. We don't escape death. So just if you're working with end of life or hospice patients, you guys rock, first of all, but you have to know there's going to be a change in their attitude the entire time, right? And their function. You might watch them decline very quickly or very slowly. End of life or hospice massage. The goal is to provide comfort and ease. We don't care at this point anymore about, oh, this could spread the cancer. It's probably not going to spread the cancer because the environment needs to be ideal for that cancer to live. So me doing a massage and having cancer maybe break off and go through the lymph doesn't mean that it's going to end up somewhere and give you cancer. It's basically what I'm trying to say. So there needs to be optimal place for it to live. Anyhow, so the goal is to provide comfort and ease. Treatment is performed where the client is comfortable. They might be in a hospital bed. They might be in a recliner. You're not giving a full body massage. You're just doing massage for comfort. You might be able to do hands and arms and feet, some legs. You might be able to get them on their side and do a little back and shoulder. Just know that it's a very short session, usually spot treatments, 15 to 20 minutes, a lot of hands and feet, some Reiki or energy work if they're comfortable with that and if you know how to do that. Any questions?
No, but you know that I said I did my first massage with my table.
Yeah.